Hello, everybody, and welcome back. This is Grayson Harris, and today we are pleased to be joined by Charles Reddy. He is the executive director of Momentum for Wheels, and they are doing incredible work getting mobility access to underserved populations across the globe. Charles, thank you for joining, and tell me a little bit more about the work that you're doing.
Yeah, and thank you so much, Grayson, for having me. As you said, I'm executive director for Momentum Wheels for Humanity. Really fascinating organization. As you stated, our mission is really all centered around promoting greater inclusion for people with disabilities, and we do this on a global scale. Our focus is primarily mobility, as you mentioned, but we also have focus on therapy, advocacy, and empowerment. As an organization, we've outlined really three strategic pillars in which we execute our program. And I want to speak briefly about each one of them, if I may. The first one is strengthening rehabilitation and assistive technology services. And really there, what we're doing is we're supporting development of rehabilitation service within the health system. What we found is a lot of times it's absent. It's not a part of the health system. It is dealt with outside of the health system, thus it's not a priority. So we work on helping build political will within governments, creating frameworks for investments for various communities, and making sure, again, this is given a priority and help them build capacity around it as it relates to training and education curriculum. The second one is assistive technology supply and provision. I know that's a mouthful, but I'm really excited about that pillar. We're really increasing global access to high quality, affordable assistive products. And within that strategic framework, we run a social enterprise, which we call CLASS. It's Consolidated Logistics for Supply Provision. And there we're making sure that, affordable, a diverse array of products and mobility aids are available to people in need. And then the third one is inclusive disaster response. We're really, really focusing on bolstering the resilience of people with disabilities before, during, and after. Often after when emergency hits, they're forgotten, or the aid that comes in isn't specific to their needs. So we've worked on a project with the World Health Organization, AT Scale, to pre-position kits. So we identified the types of, transport chairs, active chairs, mobility aids, self-care products that are needed in times of emergency. And we have those pre-positioned so when emergency hits, we can deliver those on time. And in our first delivery was in Myanmar, for example, when the earthquake hit there. Yeah, we were able to ship 4 of these kits. And these are huge kits. When I say kits, they're about 2 containers full of
These are
assistive
shipping
technology.
containers.
Shipping, yeah. Shipping containers. So it bring big. So that's a synopsis of organization. Again, it's a wonderful organization. I'm very passionate about the work we're doing and happy to talk about it more.
That's incredible. Two big challenges that come to my mind as you describe these kind of pillars of your organization is one, interconnected, the collaboration that you're doing within a lot of different sectors in terms of government, healthcare systems, and then also the direct community that you're servicing. And then also the operational challenges of actually delivering and, the supply chain challenges that you're facing. Can you elaborate a little bit more on, we can start on that collaboration piece. How is managing all these different stakeholders?
Yeah, and it's not easy, right? So first of all, we do have an office. I have about 100 people in Ukraine. So we're doing a lot of the work with Ukraine, as you can imagine, in support of the war and people there being injured and needing rehabilitation services. And we've been in Ukraine for over 10 years. I have another office in El Salvador. So some of it is just having a office present, but most of our work is done through partnerships, as you mentioned. We often partner with other NGOs, government agencies, large scale agencies. For example, when we deliver a product from Myanmar, we partner with UNICEF. So we delivered the product. They had their own ground support to distribute the product. So a lot of our work involves that. When we were talking about the supply chain challenges, if you think about it, and in class, which I keep talking about, our passions, it was designed to solve a lot of those challenges, right? One is unreliable supply. So many low middle income countries, they get donations. Great intent, but it's not repeatable. It's not appropriate in some cases. It's kind of, one size fit all, take what we need. And we address that. We make sure the products are appropriate and their provision, they're customized to the individual. Another one is cost, right? It's high costs or limited choices. So with class, we bring together a diverse array of suppliers, thus a diverse array of products that we make available that we can distribute. But then, and a big one for us is just a lack of trained providers. There are just not enough healthcare providers that are widely trained on things like the proper wheelchair provisioning. And so we go by the World Health Organization guidelines on how to,
Mm.
properly provide a wheelchair to an individual so that it's customized to fit their needs.
And for some context, could you share with our audience, maybe before the communities that you're servicing got connected with you through class, how they were getting any type of, healthcare mobility assistance and what that looked like and where the gaps in that system really were?
Yeah, I mean, in some cases, it's pretty sad, right? I mean, we've seen wheelchairs, a chair with wheels attached to the side in some cases. As I mentioned, they get a lot of freely donated product, which could be transport chairs that doesn't provide adequate postural support
Mm.
in some cases, which could really lead to more harm for the individual. As I've continued to work in this nonprofit space, there's three words that just permeate everywhere that I've been trying to attack. One is access. The second one is quality and affordability. So those are the challenges, and usually you're lucky if you can get one of those, two of those. Most countries are dealing with one, but the biggest one is just access. So to answer your question, a lot of them don't have products at all that they can reliably use, and so what happens if a kid doesn't have the right mobility aids? They can't go to school, they can't participate, they're shunned in the community, their self-worth is impacted. So this can have profound effects beyond just what you may see and can have long-term consequences
Mm.
for these communities. And so we're trying to address that as best we can, break that cycle, create economic empowerment for individuals, and make sure that these wheelchairs are just not a chair, but it's appropriate for them as an individual. It's at the right cost so that they can afford this, and it's high quality, and it's for, in some cases, terrain makes a difference.
Mm.
So we have specific chairs designed for all terrains or specific suburban terrains or outside of suburban terrain. All these are factors that play into it that you should consider.
Thank you for sharing that. I think that context is so important to understand, that problem that you really are helping solve through this, innovative program. And, you know, in order to accomplish it, right, the suppliers, they have to be there because, your organization, you're not building them yourself. What is the value add as you're going to, these medical suppliers and these organizations? You've identified that need. How are y'all getting them bought in?
Yeah, I mean, a great question. And fortunately, we actually did design and manufacture a wheelchair,
Okay.
right, for us. Yeah, yeah. So we
Well,
do it.
thanks
We
for that
contract
context.
her. No, yeah, but by and large, we are consolidating a number. So we have a list of about 8 to 10 suppliers that we vetted and work with. We have a technical advisory group that look at the quality of the chairs to make sure they fit the requirements. And the warehouse is based in Shanghai, China. So it's in the free trade zone. So all the manufacturers are there, right? So
Mm.
basically, I procure products from them, I warehouse them, and then as we work with various buyers or direct communities, we're able to deliver that diverse array via that container shipment that I spoke about.
And in terms of that procurement process, getting them to sign up and be a partner of yours, how are you kind of delivering the value or positioning that and communicating it with these suppliers?
Yeah, and so that value proposition is key, right? And so the thing that we bring is that logistics, which if they had to, when you think of supply chain, it usually falls in four buckets. There's your planning, there's sourcing and making or procuring, and then there's delivery. And so for a small, wheelchair manufacturer, it becomes impossible for them to, have that customer base, feel that market and customer base, and then deliver the products through the logistic network. So we take that away.
Mm.
We say, so as we're constantly working with different buyers, NGOs that have a need for these products. And so we procure directly from the suppliers that have met our specifications. We have agreements in place with all of them. There's the criteria they have to meet. And so this is a social enterprise. So we mark the products up slightly just to cover some of our costs and then reinvest that back into the system to keep going. But it works. I mean, we deliver upwards of 3 to 4 thousand of these wheelchairs a year in some cases. To date, we've shipped to over 72 countries with
Wow.
these wheelchairs. So and the need is still there. But the key one it is, it's more than just a nonprofit effort. It really is a social enterprise, which requires, business concepts that you've got to look at. You've got to manage the costs. You have to look at your sales channels. There's marketing involved. And in many regards, we're trying to market shape. We're helping shape the market. So we're creating demand. So a lot of our work is out talking with governments, with other individuals around the need for the appropriate assistive technology. You can see, and so as that comes about, we're able to then provide that. So we're helping to shape the market and then address that need as it comes
I think that gives a lot of important, context into the role that your organization is playing within this broader ecosystem, right? Another thing that just popped in my mind is you're managing a global organization. You have members, team members across the globe, and how are you keeping them engaged? How are you keeping them mission aligned and driven and focused? And what does that look like in terms of the leadership strategies?
Yeah, and you can imagine, and it requires constant communication. So a couple of things we've been successful. I have monthly town hall meetings in which I get all the teams together and keep them updated on what's going on and what our priorities are and the results we're accomplishing. In fact, and then actually I'm bringing the entire team together in California later this month to go through an exercise. One of the things I like to do is create a document called OGSM, where you're looking at your objectives, goals, strategies, and metrics, right? So it's an alignment, it's a cascading. So we're clear, here's our mission, here's our key strategic pillars we're working on now. What are the goals we're trying to achieve? What's our objectives for this year and how we're going to measure success? And so we look at it, everything from how we're going to do development to fundraising and marketing to how we're going to execute programs, what we're going to do in terms of, compliance and knowledge management, financial viability, class. So all of these, I bring the team together, and it's cascading. And then from that top level document, it's cascading down through the organization where they can create their goals and make sure it's all aligned. So I've used that process. I worked 23 years with Johnson and Johnson, so I came out of the for profit, and I think
Right.
one of the values I can add is some of those business principles that work is sharing that within the nonprofit space as well. And so far it's worked. And I think people appreciate the transparency and just knowing, what it is we're all focused on. So it's no question, right? If you're working on something that doesn't support, one of these pillars or goals, you got to ask yourself why you're doing it.
I have two follow-up questions on that point, and I'm excited to dive into it. So, as you are looking to realign and redefine these kind of missions, these values, that mission statement of your organization, how are you ensuring that the voice of the one constituents that you serve, and then also the voice of the people within your organization are filtering up to those high-level documents
Yes.
through that process?
Yeah, I mean, so environmental scans are key, right? Getting input, and there's a saying within this space that there is no for us without us. So I think voice of customer or voice of people that we're impacting is key. And so we're often seeking that out, and I make sure that's incorporated in organization, even at the board level. I've recruited people with disabilities on the board so we can get firsthand insight with those as issues. But I think organizationally, so I think our mission is not going to change. What has changed is, and the landscape, for example, around global funding. You've heard all the issues with the U.S. government and things. So we've got to pivot, right? We've got to look at things like, is our funding model sustainable? Do we have diversification of funding sources, right? So pivoting from relying so much on institutional support to now, how do we actively fundraise, look at new partners, and also how do we get lift in that enterprise, right? So it can be revenue generation and support. So it's all about doing well while doing good. You can do both, right? It's not an either or. And so that's a challenge, for my organization and also for us. I mean, it's creating a world without limits, particularly for people with disabilities. How do we continue to create a world without limits? So as I talk, and the other thing is just how do we need to diversify? I talked about mobility. Those aren't the only assistive technology. There's things for vision. There's things for hearing. So I want to challenge our organization to move in that space as well. So we're looking at strategic partners that align with that, so we can pull out that as a part of our AT portfolio as well.
I'm excited to dive into the rest of that kind of future vision in a moment here. As you have, let's say, coming out of that meeting later this month, you've kind of refocused and got a vision for the organization going. You have a massive amount of staff. How are you ensuring? You mentioned that it kind of filters down through all levels of the organization. What does that look like? Is it trainings that managers are going through? How do you make sure that every employee kind of understands that goal and the people that you're serving?
Yeah, and it's bringing the leaders together first and foremost, right? So it is a cascading approach. I make sure the leadership team first and foremost get that as a vision, and that they're then holding the organization accountable and sharing that. And also we try to make it so it's not so rigid that we can't pivot when appropriate. I'm big on, and I worked a number of years in China, and managing, China and India and different organizations. One thing we came up with is it works better when you tell us the what and not the how, right? So I'm big on telling organizations what we need to do and the how, leaving that flexibility for creativity, for innovation, for things that maybe I haven't thought about. So all too often leaders, we get too prescriptive, right? And we tell people how to do something. That's the way they'll do it. But if I give you a problem, my expectation is you may come back with solutions that I haven't even thought about. So that's really the concept. I like to paint problem statements and what we're trying to address, and then allow for the organization to come back and say, okay, here's how we can best do it and get that aligned. And that works better because you get buy-in. You get buy-in as opposed to just telling people what to do all the time.
Incredible. As we, you hinted at this earlier, but as we look to the future and the end of the year, what is the organization kind of direction? What are you thinking in terms of the?
Yeah, I mean, so somewhat in regards, we're like a phoenix coming out of the ashes. We've gone through the phase with funding cuts as it relates to a lot of the you know
USAID.
USAID and funding. And so we've kind of come out of that, repurposed Oregon. So I've had to do some streamlining and shaping of the structure as it relates to that. But then we can see our path forward now. So we're clearly aligned on we're going to be talking about what constitutes success over the next 6 months as it relates to the financial one, but also the people we serve, right?
Right.
So I'm big on, shifting from, talking about outputs to outcomes. And so one of the things when I took over this role was to get clarity of our theory of change as an organization. How do we want, and what's the intended impact? So we always go back to what's that intended impact? Clarity on what's the group we're trying to address, what issues we're trying to resolve for them, and what impact we're trying to have. So that's the exercise, is to look at that end in mind state and making sure whatever we're doing, we are doing it for those people with disability. How do we know that they're more included? How do we know we've created job opportunities? So we have those sort of leading indicator metrics around the number of people we serve and all the great sorts of technology that we bring. But all those things need to translate into some measurable outcomes. And so that's the focus for us, and understanding what that is.
Well, thank you for that answer. And Charles, thanks for coming on and sharing more about the impact that you're making, for these people that are getting this mobility access, oftentimes probably for the first time, and also the direction of the organization and the leadership tribes that really go into running an organization of the caliber of Momentum Wheels for Humanity.
Thank you.